Now, the relatives of several care home residents who died from coronavirus are suing the Health Secretary for England, Matt Hancock. It's a terrible figure when you look at it. More than 20,000 people, care home residents in England and Wales, have died since the beginning of this outbreak. Now, Boris Johnson was heavily criticised for saying, and I quote him, "Too many care homes didn't really follow the procedures." It's nonsense what he said, and he refused to apologise for it. And many in the care home sector were very, very angry, and one charity boss called his comments clumsy and cowardly. But needless to say, Matt Hancock refused all invitations to apologise for what Boris Johnson had said. Well, John Godden is the Chief Executive Officer of Salutem, a company with 120 care services nationwide for adults and children with complex physical and mental needs, and joins me now on the line. Very good afternoon to you, John.
Afternoon, John.
Thanks for joining us this afternoon. What did you feel when you heard Boris Johnson say too many care homes didn't really follow the procedures? What procedures were they that the care homes didn't follow? Because the Prime Minister himself didn't seem to know, and every time he was asked which procedures had been missed by the care homes, he just mumbled and distracted and said, "Look, there's a bird," and tried to get us to talk about something else.
Well, I think that was the answer. Look, it's very difficult to be critical of things that were unknown to us, unforeseen in many ways back in the early days of March and April. But I mean, I think he really hit the nail on the head. Not following procedures is really very shy of the mark, because there was so much different information, so much, it was very, very fast moving. You know, we were really struggling to make sure that everybody in our organisation was very clear about what was needed and what was the right protocol at any given moment. And, you know, it's not like it was easy to make mistakes. I just think everybody needed to apply their own sense, their own knowledge. And as care organisations are good at infection control, that's what we do. I mean, the people in our care all have significant issues to deal with on a daily basis. And, you know, every winter we're fighting against flus and noroviruses and these sorts of things, because, you know, they're more difficult to deal with for the people in our services than the general population. So we're used to that and we're good at that. But to suggest that a lot of the death rate was attributable to not following advice really disregards the fact that this was all new. It was very, very difficult to work out what to do at the right moment. But really, you should expect care homes to be places that are safe, that practice very, very good infection control. All those things that we've now learnt as a world population actually now are things that we did already. So whilst I think what he said was indeed very, very clumsy, massively unwelcome, particularly by all those who really stepped up and fought very, very hard to protect everybody in their care through this. You know, the government advice was a little unclear. I think that's being kind, but really care organisations should have known what to do in many circumstances anyway.
Yes, because what Matt Hancock did was answer a question that hadn't been asked of him. And that's one of the things, as a politician and a journalist, I find absolutely infuriating, because what he said when he was asked to apologise on behalf of the Prime Minister was, he said, we were learning as things went along. Well, that's not the question that he was being asked. He was being asked to apologise for the suggestion by the Prime Minister that care homes had deliberately disregarded the best advice that they had at the time. Of course, we all learn different things as this advanced. That's a different issue. And he refused to do that. And I just think that's sort of slippery and sleek it and brings politics into disrepute. Can you remind us what the advice from the government in England was at the beginning? What advice did they give you, and how has that changed in the months subsequently?
Well, I mean, look, the sensible answer is it seems like a very long time ago since we were dealing with these things back in March and April. The flippant answer is, sorry, which day are you referring to? Because
was it as bad as that?
Yeah, and it was, and that's understandable. Look, we went from a period in late January with this thing beginning to bubble up, and what was it? What were we going to have to do? How was it going to affect us? Who was it going to affect? And then the advice rapidly got into protect hospitals, create capacity in hospitals, and that was, I think, the advice that everybody accepts the government were taking and listening to. What then the consequences for care homes, I think, was something that sort of didn't follow through fast enough. So we were getting, as a sector, very, very different advice every day, and indeed vacuums of advice. And again, you can understand that because there was a lot going on, and resources were sort of really being stretched to the limit in government in terms of thinking, as well as the front line in terms of practical issues around getting hold of PPE. But it really did change very quickly. As an organisation, we took a view that we would take one entity's benchmark to guide us, which was Public Health England, because there was a lot of conflicting advice. And we nailed our colours to that mast. And we said, right, look, PHE, they're the ones who are going to define our minimum standards that we're going to follow. But of course, we would enhance that. Whether you take an admission coming out of hospital into your home was the big issue at the time. And, to say, no, you can't do that, misses a lot of the point of what care is about. And, of course, government wanted people out of NHS, hospitals, into care homes. Care homes are not hospitals. They are places of care. But care homes needed to be able to set up isolation units, have the correct PPE, make sure their staff were trained in those new things that were coming. And some are set for that and some are not set for that. And each individual care home and company needed to be making their own choices. Our view was the most important thing was to protect the people we already had, the people already in our care and our staff. And that was our sort of guiding principle. But it literally did change in that period, late March, early April, as we were going into lockdown. But I mean, we'd already locked our homes down in early March. But advice did change very, very much. And there were issues around whether any of our service users who have severe health issues should be going into hospital to receive treatment. So something as basic as that. What do you do? Do you allow them to go with a enhanced risk of catching COVID, or do you care for them in the environment you've got and hope that whatever their other issue is can be contained and dealt with? Not easy, but you can't then, some months later, just look back and go, look, it's all your fault because you didn't listen to everything we said, which, best will in the world, was mixed.
I have direct personal experience of this because my mum was in hospital after a fall in Glasgow, and COVID arrived in the hospital, just one case of it, and the woman who had COVID was put into isolation, but they were very concerned that there'd be a huge influx of COVID patients. And so the doctors spoke to me and they said, it's up to you. It's up to you to make a call what you want us to do. Your mum can either stay in the hospital or we can transfer her to a care facility. Since she's had a fall and there's nothing really wrong with her, she doesn't need the level of intensive medical care that we can give her here. And I asked the obvious question. I said, what are the chances of her picking up COVID if she stays here? And he said, well, we don't know completely. It depends how many people arrive with COVID. We'll do everything that we possibly can to protect people. And I said, so do you think that my mum would be safer if she went to a care facility? And the doctor's advice was, on balance, yes, that's what I would do with my mum, the doctor said. So I gave permission for my mum to be transferred from the hospital into the care facility, and she was kept in isolation, just as you say. The clear concern of the people in the care home was to protect their residents from somebody new arriving. So she didn't get to meet any of the other care home residents. She was kept in isolation and she was tested for COVID at the end of the isolation period and was found not to have COVID. So that's how they handled it. And everybody who came into contact with her was wearing full PPE, including the ambulance staff who transported her to the care facility. And I wasn't allowed to go and see her because they said to me that, that was the Scottish Government rule. You couldn't go and see people who are in care homes.
But care is a continuum of risk assessments. That's what it is. And it's balanced. And at the moment, we've now got these discussions around the balance between exposure to potential COVID, and that is any time when you've got people moving around and sharing space. And the more you do that, more risk, versus people's other physical and mental health. And, those are those constant risk assessments you have to take. So there were no right and wrong answers. And indeed, there was no direct guidance about you have to do this and you have to do that. You have to risk assess and you have to do your best. And, there is no surety and certainty of outcome in care. You've got a bunch of guidance and a bunch of standards and most importantly, a bunch of experiences from which you draw to give you the best outcome for in that case, your mother. We had 7 of we look after around about 1,400 people, all with everything from severe mental health through to cerebral palsy. We took over what used to be the charity Scope, their schools and care homes. So lots of people with cerebral palsy. And, they're very sensitive to catching colds, let alone catching COVID. So out of that, we had 7 people who tested positive for COVID. We had quite a few more where we thought there was a chance. But those 7 were all where they interacted with other parts of the health service. So risk was taken. One of them had a severe heart condition, had to go to hospital, and sadly got COVID, which became part of her the battles she was having at that time. Then you get into the issue, okay, right, she needs to now come out of hospital back to the home for her mental health. How are we going to do that? How do we isolate? Who looks after her? And some incredible brave people isolated with her, knowing that the risk of them getting COVID was significant, even wearing PPE. So it's this constant assessment around this risk versus that risk. And it's not no risk versus some risk. It's that risk versus that risk. And that's where you go. I think it has been a real shame that in care homes we've seen so many deaths. But let's be clear about what elderly care homes are. They are, to a large degree, end-of-life care for people who have a lot of other conditions. And COVID is something that's part of that matrix. The numbers look really scary. But,
I was going to ask you about that's exactly what I was going to ask you about, the numbers. Nicola Sturgeon was on the Andrew Mark programme today, and she said that she thought that the number of deaths in England had probably been underreported in care homes because the increase in deaths in care homes is much higher than it was for this same period last year, pre-COVID, and yet the increase wasn't all being regarded as COVID deaths. And there's a lot of people probably who may fall into the COVID death category, who aren't necessarily having COVID put on their death certificates. Is that correct?
Yeah, but I think it swings and roundabouts. I think there's some, we've only now got into a regime where testing is fully available. I actually got tested myself yesterday. I'm in and out of some of my services, so I needed to go and do that. And luckily it's one of those tests that I was very happy to fail. But testing wasn't available in the early months. And so I think there were misdiagnoses. COVID was apparent, so this is a COVID death. COVID wasn't apparent, so it's not a COVID death. But look, in the population of elderly care homes, your expected rate of passing away is between 25 and 33% of the population every year. Okay, that's normal. And there's 550,000 people in elderly care homes at the moment. So 30,000 sounds like a lot of people, and every death is sad for those around them. But I think you need to contextualize it to some extent. But there's 2 waves that I was really concerned about. The first one, which really worried us a lot in the sector, was all of the initial reporting around COVID deaths completely ignored what was happening in care homes. And that was bad because we were being ignored. And, I do think that as a predominantly privately owned sector, we should have been responsible for our own PPE, and we were. So it's not good enough for a private sector to put their hands up and say, government, you must give us this. We needed to do it ourselves, but, there was this massive requirement for PPE. But care homes were perhaps not the loudest voice there, and we didn't get as much access to it and as much preference around it because we didn't have these deaths being reported. And the same around that movement from hospital to care home. I think that might have been educated better had we had more data in those early months. And I remember it wasn't until about early May when suddenly the government started recognising care home deaths every day in their stats. So that was good. But the other piece of data, and you just referenced this, is the normalised death rates in care homes. And as we sit here today, the normalised weekly death rate in care homes is now below where it would be at this time of year, because obviously it's a seasonal thing. Yeah, so we've now gone down. And our view is that infection control and the use of PPE has now become so good in care homes that the other things that cause the ultimate death of the elderly particularly are happening rather less. Now, we've got to be on our guard around that because we all know that treatments for things like cancer and other things have not been as aggressive as they would be in normal times, and hopefully that will come back. But we are back at a new normality now, and we need to stick there. We're all bracing ourselves for second wave in October, November. But our message to anybody who finds themselves in a position you found yourself in with your mother is that, care homes are safe places to go. And again, always, it's always dangerous to generalize, but a well-run, good care home is the right place for somebody to go who needs that kind of care. It's that staff have got the right equipment, training, attitudes, experience, all of those things. And people now should not avoid going to care homes if that is their real need. And that is a different place to where we were 2 months ago.
Fascinating discussion. I'm absolutely delighted that your test came back negative, and I'm very moved by the story that you told me about your staff volunteering to go with a patient and go into isolation in order to nurse your patient and to protect your patient. It's an inspiring story. John, thank you so much for joining us. That's John Godden, who's the Chief Executive Officer of Salutem. That's a care services provider based in Yorkshire.